Hi, everybody. This is David Nevins for City Biz, and welcome to our program today. We're delighted to have you. We have two special guests today. The first is Mr. Tim Regan. He is the president and CEO of the Whiting Turner Contracting Company and a good friend. Tim, welcome to our program.
Thanks, David. Good to be here.
And the other is Dr. Issa Davis, and she is the Associate Vice President for Community Health of the University of Maryland School of Medicine. Dr. Davis, thank you for joining us today.
Great. Thank you for having me.
So normally it's ladies first, but I'm going to let Tim kick it off if you don't mind. I don't want to be rude here. So Tim, a couple years ago, you bought the old Target store at Mondawmin Mall and decided to create something called the Village at Mondawmin. So that's how this all got started, and that's why one of the things we're going to be talking about today. Tell us a little bit about that project and how it's coming along.
Absolutely, David, but let's be accurate. My wife Joanne and I bought the Target store, so
fair enough. Fair enough. I don't want to make an enemy of Joanne by any means.
No, she'll track you down. No, it's going along great. I think just a little bit of the backstory. You know, we've been in the community for, well, a long time now, probably since 2016 at least, with the Touchpoint Baltimore operation that Calvin Butler and I founded back then. And so, you know, it was sort of a, I guess a quirk of fate that I was here working in the community when the Target closed, and I kind of got the idea that it could turn into something good at the end of the day. And so after we had a chance to capture the property, and Target was very, very helpful in kind of understanding where we wanted to go with it, and they helped us out to gain possession of it. We met with the community a lot, and some of the most important things on the community's mind, of course, was workforce development, childcare, retail amenities, but really first and foremost on everybody's mind was healthcare and access to healthcare for all ages, but particularly for seniors and for young people. So that's been a driver and really kind of is why this deal is so important for us.
So we are talking about today the addition of yet another program to the Village at Mondawmin, which includes the University of Maryland faculty physicians. And so Dr. Issa Davis, welcome again.
Great,
and why don't you tell us how your new program coming to Mondawmin and coming to the Village at Mondawmin, what you help to accomplish, and in terms of the services that will be offered to the community there.
Great. Thank you. Well, we were extremely excited to get this invitation from Tim Regan to join this village and to bring the health services. So we are looking to do something unique and different for this community, and that is to create a medical practice, or we like to call it a health village or medical home, that will provide comprehensive services, primary care and prevention services from, as Tim said, pediatrics, so children, all the way to our seniors, really focusing on the whole family. And a place where when they walk through the doors, they'll receive medical services, dental services, and a one-stop shop, lab services, radiology. So you get all of your medical needs kind of taken care of in one space. And then we'll also have a few specialty services there, and really just making it a place where the community will have a physician or a medical team that they can trust, that when they walk through the doors, they're seen, heard, and valued. And they can get their medical needs taken care of, and also be a place for health education and resources that they can use to help themselves stay healthy. Because the large part of being healthy is what you're able to do, and so we also want the community to feel empowered to be able to drive their own health and wellness by having access to those resources.
Yeah, I mean, excuse me, sounds like a marvelous asset to the community. Tim, if I could go back to you and just ask, you put together such an outstanding array of I guess, tenants, if you will, but really partners as well in the village at Mondawmin. What led you to the University of Maryland, and how did you make this happen?
Yeah, so just a little bit of background. You allude to the other partners, and that's truly what they are. We do have um, uh, an organization called Edenbridge PACE, and that PACE is Program of All Inclusive Care for the Elderly. That place, which is separate from the University of Maryland, but they will have a collaboration as well, is focused on much older people who are still living at home but qualify for some skilled nursing services, and they can come and get those during the day and still go back and sleep in their own beds at night. So PACE is a very important partner of ours. Care First Blue Cross Blue Shield, very, very dedicated to this project. We'll have a call center and a training operation. Along with those, of course, we're moving our Touchpoint Community Center, and Whiting Turner will have a conference center there as well. But this piece with the University of Maryland is so important to pull the whole thing together. And to answer your question, the west side of Baltimore, has, very, in certain communities, very thin access to primary care. And it takes a long, long time to develop a strong, enduring relationship with your primary care doctor, and to get that comfort level, as Dr. Davis says, to come back to the same doctor, even for well visits, to make sure that you're getting in front of diseases and conditions that could cause you big problems later. So Maryland geographically makes a lot of sense, but just the sheer reach of Maryland in terms of the specialties that back it up, and quite honestly, even collaborations with Hopkins that they have, so that you have access to world-class healthcare, from your very own neighborhood. And I'm telling you, the neighbors could not be more excited about having that University of Maryland shingle up within walking distance of their homes.
Yeah, and Dr. Davis, let me go to you. I know, of course, I've followed this project quite closely, and I know what Tim says to be true. Why was it so important for the University of Maryland to participate? You are a big medical system with hospitals all over the state, and yet now you're just locating in a community in West Baltimore. From your perspective, what made this so important to the University of Maryland School of Medicine?
We are in the community, as Tim pointed out. We are in West Baltimore, and so we see the community as our neighbors, and certainly want to be able to bring more services out into the community. We already take care of this community within our downtown and midtown medical centers, and we understand some of the challenges. Even to come to care, get your care at those facilities are oftentimes transportation and such. And so here was an opportunity for us to come more into the community, and as Tim said, provide more access and availability right there in their own home, right in their own backyard. And so we've been working in the West Baltimore community for a very, very long time across all of our 7 schools that we have. And so this was just a wonderful opportunity to come out and bring more services right where the community needs it. And so we're and looking really looking forward to, as Tim mentioned with the Target, we understand that Target leaving, left a real pain point. And so we want to be a part of the healing for the community, and how best to do that, but to be present. And so this gave us an opportunity to be more present for them and be a partner with them in that healing.
Yeah, and Dr. Davis, I was recently reading an article. It spoke to the point I think you just mentioned, that in a lot of underserved communities, in particular from a healthcare perspective and what have you, they don't necessarily feel welcome you have these big giant hospitals at Midtown, as you noted, and the primary hospital downtown, University of Maryland. And so the future of healthcare is really going into the communities and helping people in that regard as well.
Absolutely, because you don't want to go to a hospital, right, unless you really, really need it. And we understand right now, many people are using the emergency room as their primary care, which is not the best utilization of their time. And so, to be able to provide a practice, as Tim mentioned, a team of medical doctors and nurses and staff who are there, who can build a relationship with them, and a place where you can easily get to feel comfortable in because it's in your community, and be able to work on those screenings and preventive services to help keep you out of the emergency room. That's what we want to do, right? And only for you to have to use the hospital only if and when you need it. And so I think this, you know, kind of right-siding healthcare and making more access to primary care and preventive services is really how we're going to improve the health of the community and of the population. And so yeah, I do think having a practice that feels comfortable, that you can easily get to, is really, really important.
No doubt about it. Is it too soon to ask you when this will all be up and running?
So we are anticipating a year from now. Yes.
Okay, terrific. And Tim, let me just go back to closing with you. You put together, you referred to them as partners. You put together such an amazing, I think, array of services and partners in it. Your dream has obviously come to fruition. So kudos, times 1,000 to you and your colleagues, who had this dream, this vision in that regard. But what's next for the village? What's missing, and what's next, and where do you go from here?
Okay, I'll do that, but I'm gonna I'm gonna take the opportunity to say something I think is really important for people to hear, and that is, this was a very, very difficult deal to put together, and I want to make sure that I give credit to, well, a couple really important people. Let me just say, with faculty physicians, Dr. Bill Regine and Rachel Hoover worked really hard. Dean Gladwin, of course, and President Bruce Gerald. But Dr. Davis was a force of nature to make this thing happen. Let me tell you, this has been an education for me. I'm just a lowly civil engineer who knows how to pour concrete, but what I learned along the way, and I muttered this to myself multiple times, and that is, no wonder we don't have health care in underserved neighborhoods. These deals are very, very difficult to put together. But she would have no parts of this thing falling apart. I can't tell you how many times Dr. Davis tied this thing back together and drug it to the finish line. And it's going to happen in large part because of her strong will to bring healthcare to the community. But to your question about wrapping up, the Maryland primary care takes us to over 75% on the leasing of the facility. And so the only significant pieces that we have left, we have a 10,000 square foot piece that we're very close to putting a childcare deal together on, so that people in the village can use that for their kids, and then also some of the community will be able to have their kids in the childcare center. Very, very important. And then finally, kind of the icing on the cake is the retail row along the front of the village, where we have that beautiful little plaza out there in the seating area. And so we have conversations going on We don't have anything completely nailed down because we really wanted to wait while we got these other deals in place, because retailers obviously want to know, okay, how many are coming and going each day in the building, and we do know that now. But you're talking coffee, baked goods, sandwiches, maybe a sit down option, certainly a healthy option, bowl and salad and that kind of stuff. So we really want to put some amenities out front there, and to have it be locally representative. You know, many Black owned businesses across the front there. So young kids can come in there, look across the counter and see someone where they can say, you know what, I could do that one day.
Mm-hmm.
You know, I could have a store, I could have a business, and really give them that, you know, if you can see it, I can be it moment.
That's right.
So that's what we're trying to do. And that will fill up the village, I'm happy to say.
Well, I know you're going to make it happen. Dr. Davis, let me give you the last word, if you don't mind.
Yes. Well, thank you for having us. And I'm very excited about partnering with Tim, who is the visionary on all of this. I think what he has put together, we're going to look back in 5 years and really see the genius in it. I think this is an opportunity to bring like partners together. And while we may be bringing the medical services, it's going to be wonderful to partner with the other tenants in this kind of community hub idea that he has. And as that, you know, the old adage is, it takes a village to raise a family, but here it's going to take the collective, all of us collectively in the village at Medamin to raise, or not to raise, but to support and to grow our community in West Baltimore. So we're really excited about being a part of the community and really helping in this effort.
Well, thank you very much. And as you noted, yes, literally and figuratively, it takes a village, in this case, the village at Mondawmin, to make this happen. You both have my my admiration and respect, and keep up the good work. And I know you will get to the finish line shortly. Thank you both for your time today.
Thank you. Thank you very
Thanks,
much.
David.
This has been David Nevins for City Biz. Thank you so much for joining us today.